Hi guys, you're welcome back to this platform. If this is your first time seeing my face, my name is Eunice, and today we are going to be doing the part two of the courses I studied as a dental student in a federal university in Nigeria. So I have started on the courses I studied in my elementary stage and my preclinical stage in the first video, and in this video we'll be discussing those courses I studied when I moved to the clinical aspect of my study. And if this looks like what you love, or maybe you just like seeing my face, let's get right into it. So, when you have heard or you have seen that message, dear candidate, you have successfully satisfied the examiner in the just concluded part one exam. Oh my god, that message means a whole lot, especially when your matric number is there. So we are going to be discussing those courses I studied when I crossed to the clinical arm. As a dental student in UI, for our clinical arm, we moved from the main campus in UI to the University College Hospital called UCH. There's a hostel for us there, and that is where we stay. And then when you move to your clinical aspect, then that is when the real work begins. For a start, you are going to start with two set of courses that we call pathology and pharmacology. So when you come in first, they're going to do white coat ceremony for you. Hey, don't snooze. It's not going to be all that smooth and jolly jolly because you are about to start real work. In your clinical aspect, you are going to study pathology and pharmacology. Those are the first set of courses you are going to be introduced to. And pathology is the study of diseases on all levels. We have studied anatomy, which is the structure, and the physiology, which is the function, and then the biochemistry. But now, those are the normal. For pathology, they are now going to be teaching you the abnormal things that could affect all those structures, all those things that you have learned when you're in clinical aspects. So that's why your clinical aspects, your preclinical aspects has to be solid, because if you did not read well, if you didn't listen in class, if you didn't do very well and you just say, "Ah, let my people go," if you get to the clinical aspect, you might have issues when you start learning about the diseases. So the diseases that can happen to every of these organ system, from every system, one system to another: respiratory, reproductive system, the GIT, the brain, the heart, the muscle, infections, different kind of infections, tumors, cancers, different things from all levels. You are going to be learning it. And for your pathology is divided into four sections. You be like, why is it that all these courses are always carrying branches? Now, so we see am o. So your pathology is going to be divided into four sections, and the first section is your hematology, which is a study of the disease of the blood. You know, in the blood we have different cells, different components: the white blood cells, the red blood cells, platelets. We have the clotting factors, a whole lot of things in the blood. We are going to be studying the diseases of every of those components in hematology, and some other things. So lymph nodes, the lymphatic system, they are also going to be, you will be taught things under that in hematology. Also, we have the microbiology. In microbiology, you are going to be studying diseases which are caused by microorganisms. Then you'll be hearing about strep's, about streptococcus, about staphylococcus, about some other different things: gram positive, gram negative, Klebsiella, gbogbo, gbogbo, gbogbo. You're going to be learning all of those things under microbiology. So microbiology is going to help you to see all those little minutest things I cannot see with your eyes, and even some things that you can see with your eyes, like tapeworm, hookworm, this and that. You are going to be learning it in microbiology. And then we have the next one, which is chemical pathology. In chemical pathology, you'll be learning diseases that happen due to an increase or decrease in the chemical components of your body. So all those things like calcium, magnesium, different hormones, different things that makes your body work in the normal sense in terms of chemical. We've done biochemistry, so to me I feel like chemical pathology has some elements in like studying some level of biochemistry that you have. So your knowledge of biochemistry will actually help you in chemical pathology too. So in chemical pathology, you'll be learning all those things, how increase or decrease in this particular hormone or this particular chemical in your body is going to cause diseases. And then lastly, we have histopathology. Histopathology is like, to me, even though it was histopathology, yes, it's the diseases at the cellular state. You still learn some element of the diseases of the gross, like the gross anatomy, the structures, the regular structures in the body, and also how it affects them in their cellular state. So pathology is also very interesting. When you learn pathology, you start discovering, oh, this is why this thing happened, this is why if this thing happened, this will not happen, this will not happen, this will not happen. In short, pathology is going to make you know a lot about diseases and how they occur. And then the twin brother of pathology, which is pharmacology, is the study of drugs and how drug works. That's this basically how drug works. We have a whole lot of drugs in this world for different kind of ailments, how they work, their mechanism of action, their adverse effects, their advantages, and everything you're going to be learning is under pharmacology. So as you're learning pathology, you're learning pharmacology, and you're merging the knowledge together, because as you're learning about those diseases, you're learning about the drugs that could work for those diseases. And just like I say, is very, very beautiful. So you are going to learn that. And even though that is like your 300 level second semester, but I want you to know, especially if you're in UI, that immediately you cross to the clinical aspect, forget about your level. You will only know your level based on your colleagues that are in UI. For example, now, if you are in 300 level second semester and then you cross, your colleagues, they are also in 300 level second semester, so that's how you will know your level. Because when you get to the clinical aspect, it's not by level again, it's by posting. So immediately you get to clinical aspect, there is a posting chart, we call it a flow chart, that would tell you when you are going to graduate. But like I said, it can also be hampered by strikes and everything, but you literally know all your postings, everything that you need to do from the time you step into the clinical aspect till when you are going to graduate. So it's those things that you are going to be following, but they will not say that, okay, 500 level, 600 level. You only know your level based on your colleagues on the main campus. So when you are doing that pathology and pharmacology in my school, they will also expose you to medicine and surgery. When you start to learn about medicine, that's when you start interacting with patients one on one. They'll teach you how to collect, how to take a detailed history, how to examine a patient, the kind of investigation you are going to do, and the kind of treatment. They will tell you, they will explain to you, they are going to put you through and teach you how the questions, the kind of questions you are going to ask that will lead to helping you to know the kind of diseases that is affecting the patient, the examinations that you are going to do to detect them, and then the investigations, those tests, those assessments that they will go and do, that you make sure, oh, sure, this is this thing that I'm thinking about, this is exactly what it is, and then what the treatment is. And then the surgery, in surgery you are going to learn how you use surgical operations to remove diseases or to stop diseases or to correct defects. So in surgery, there are those things that if you put medicine from today to tomorrow, it's not going to work until you go into the theater and you correct that thing surgically. So they are going to be operating, you'll be operating the body, seeing all those things that you have learned, you will also apply it. Because if you don't read your anatomy, where you don't know your anatomy, you might find surgery difficult. That is it about medicine and surgery. So after your pathology, you are going to write what we call the part 2 exam. Note that at this phase, there is no I am in dentistry, I am in medicine. You are going to be writing the same exam, and you are going to be writing your part 2 exam. So part 2 exam also follows the same realm as part 1 exam, and that is where you are going to write your MCQs, your essays, you do your OSCE, your practicals, and then you do your orals. And yes, I said it's probably under 6 minutes, but God is your strength. And if you are coming to UI, another gist for you, say, I will climb. I will climb. You will climb, because when you start to go for your practicals, especially pathology practical, you will climb. You will climb and climb and climb, but then you are going to be fine. You will have done pathology, you do pharmacology, you do medicine posting, you do surgery posting, you do pediatrics posting, you do radiology posting, you will do infectious disease posting, you will do I think I've mentioned all. Yeah, all those processes, you are going to go through all of them in cycles and in cycles and in cycles until you finish. But then before you finish all those things, you would have done your part two exam. After that, when you now finish all your postings here over here, you are now going to do your part three exam, which is going to be medicine, surgery, pediatrics, and IDU. You are going to be writing it in your part three exams. And also a bonus for people that are coming to UI. You usually write, by the time you are writing your part three exam, it's usually the same time when two sets away. Let's say for example now, um a 2021 set. When I was writing my part three exam, I wrote it with 2K18 set, the final year. So final year medicine that are graduating, they were writing, that was, part four for medicine is medicine and surgery, and then some other specialties included. So for us to, is medicine and surgery. So you will write it at the same time in the same hall, but then different questions. There will be some questions that are added to theirs, and some but will not be added to yours, but it's the same time you are going to write your exam. And when you are done with your part three, then it's high time to say that you're welcome to dental school. Hey, 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 hey. You're welcome to dental school. Then that means that all the regular night calls, clerking patients in the middle of the night and stuff like that, they would reduce or they will even stop safe. Calls for you as a dental student. No, no, no. In my school, we don't go for calls as a dental student. So that's the spec. I know your colleague be like, hey, you people they used to go for call in the night, even though we shower from morning to evening. Well, that is it about the medical surgery, pathology, and stuff side. When you get there, when you pass your part two examination, that is when that line, the distinct line between you as a dental student and your other medical colleague is drawn, because at that point in time they will go ahead to start doing their obstetrics and gynecology and all. Over here in my school, even though you are already in like 500 level when you were doing the medicine, surgery, pediatrics, and all, when you get to dental school, it is seen as if you are still in 400 level. When you cross to dental school, you're going to get orientation. They're going to tell you, see, dental school is a small family, a small, beautiful family that you're going to enjoy. By the way, if you have not watched this particular video, Professor Ogba, it is an oratory, a speech that was made by one of my senior colleague when he was in um dental school, and that literally explains some of the things that I've been explaining since morning, and you will actually really love it. I'm going to link his channel in the description box below, so please go and see Professor Ogba. You are going to like it. I actually like Professor Ogba. It was really, really nice. It was a very nice one. So you're going to like it. But then he was mentioning something that, oh, welcome to dental school. Your consultants are our daddy, registrars are our mommy and uncles, as officers are like siblings and brothers and stuff like that. And that is what dental school here is for you. But then let's go to the course aspect. So when you get to dental school, you're going to do oral anatomy, then you're going to do operative techniques. You will do prosthetic dentistry, you do operative techniques, you are going to do practicals. In prosthetics, you are going to do practicals like fabrication of trays using shellac. You are going to design a complete denture. I'm going to link pictures and videos if I could see. Yes, they are very hands-on, they are very interesting, but you are gonna work. You're gonna work. You'll become a firebender, water bender. Sorry, I was referring to the speech. So if you avoid the speech, you will be able to relate to all the statement I was saying. But well, that is it for your first year in dental school, which is going to be your 400 level. So in that 400 level, after all those things, you are going to be writing exams. In your oral anatomy is like an advanced stage of your dental anatomy. You are going to be learning much more things, but then in the advanced stage of the structures. And then for the operative techniques, which is called optic. You are going to be taught how to cut cavities, the normal positioning, how you are going to like stand, the different classes of caries, and you will learn a lot of things under conservative dentistry. Sorry, have I been saying prosthetics since? Sorry. In prosthodontics, you are going to learn how to fabricate dentures. You're going to be learning about different materials, and also you learn science of dental material is also a course in your part 4. And in your part 4 for science of dental materials, you will learn a lot of components. See, they are going to bring your chemistry back. I'm so sorry, but you have to learn them. So you learn about waxes, about different things, acrylic, about composites, about a whole lot of things. You're going to be learning those things, and you are going to learn them sharp, and you are going to be fine. So after all those things, you are now going to do your part 4 exam. So your part 4 exam is like all of those things that you've done within those months, your operative techniques, your prosthodontics, your practicals. You are going to do all the practicals that you've been learning in class. You do them during your part 4 exams. You're going to do oral anatomy too, and you are going to do your science of dental material in it. Then you are going to move to part 5. And my part 5 is one of the most beautiful periods. It's a very short, but oh my god, I love it. I love it so much. It was one of the most beautiful experience I had. So when you move to part 5, you are going to be doing two courses, but those two courses they have children inside of them. They are pregnant. The first one is oral pathology. So under oral pathology, you'll be doing oral pathology itself, you do oral medicine, you do oral radiology, and you do forensic dentistry. While under child oral health, which is the second one, you're going to be doing pediatric dentistry and orthodontics. So you'll be doing pediatric dentistry and orthodontics, which is actually very marvelous. So for oral pathology, you'll be doing the diseases that affects the mouth. That's when they'll teach you how to diagnose diseases in the oral cavity based on all those knowledge of your disease that you have been learning and the knowledge of your anatomy. So they'll teach you how to take history, how to examine the investigations, how to arrive at a diagnosis in oral pathology, oral medicine too, some oral conditions and the medicine that is involved in treating them, and then oral radiology, the different oral radiological aspects of your mouth, your teeth, every of the structures in the mouth. You are going to learn this. And forensic dentistry is how to use the knowledge of your oral anatomy, oral pathology, diseases to be able to identify victims, dead victims from remains, solve crime case, and all of that. Some people will already be attracted to forensic dentistry, but it's a very lovely course. So that is it about oral pathology. And then we have child oral health. Under child oral health, you are going to be doing pediatric dentistry and you'll be doing orthodontics. Pediatric dentistry is literally dentistry for children. So instead of adult children, and because the mouth a child's mouth is usually different from an adult's mouth, because adults' mouths are already established, they've grown to their full extent and all. But child's mouth is constantly changing and developing. So what you will see in a 2-year old is different from what you will see in a 6-year old, it's different from what you will see in a 8-year old, it's different from what you will see in a 14, 15, 16-year old, because everything keeps developing. So in pediatric dentistry, you will learn how to manage children, because children are so lovely. But in terms of receiving treatment, they can be very, very funny. So how to manage them, how to handle their behavior, how to treat them properly, even while you want to offer the best care for them. So pediatric dentistry, you will learn to sing. Better go and be training your voice. You will sing, you will dance, and you are going to work too. So you will not only learn that, you start carrying out procedures, you will do composite filling, scaling and polishing and all. So you are going to be doing it in pediatric dentistry. And then the second aspect of the child oral health is the orthodontics. And orthodontics has to do with the arrangement of teeth. People that you say that, why does she have different layers of teeth? Why is her teeth scattered? Why is her teeth like this? Why is her teeth like that? Orthodontics is the area of dentistry that helps to correct all those malalignments, all those malocclusion, all those deviation from the normal that you have in your teeth. So that is when you are going to learn a whole lot. We learn a lot. I enjoyed my 500 level because I just loved all those courses. They were so relatable. They were so enjoyable. You know, oh, that is why. Oh, this person. Oh, that's a whole time because you're going to be learning very interesting new things. And after that, you're going to be writing your part 5 exam. So your part 5 exam, just like all the other formats I've been mentioning, you will write the exams on all those courses that you have studied in your part 5. You are going to be writing the MCQs, the essays, practical aspects, the OSCE, but now it will now be both OSCE, but here you will do your OSCE separately. Then you do examination, you are going to collect patients, you take history, you take examination, and you are going to present the case aside the OSCE, that is that movement from one table to another, aside that clinical one, you are going to do it, and then you are going to do oral exams. And after you have satisfied your examiner, then we come to the last phase, which is the final year and the phase that I am 600 level. So after you have satisfied your examiner in your part 5 exam, you move to your part 6 level. And for your part 6, you are going to be offering oral and maxillofacial surgery. You are going to be offering restorative dentistry and periodontology and community dentistry. For restorative dentistry is also divided into two, which is the conservative dentistry and the prosthodontic dentistry. For your oral and maxillofacial surgery, it deals with surgery in all its entirety, tumors, cancers, swellings. They also deal with traumas, road traffic accident that deforms the face, that breaks the jaw fractures, tooth issues, and everything. Oral and maxillofacial surgery, they are also the ones concerned with extraction. So that one that used to pin on us that dentist is not to remove teeth, is only the area of oral and maxillofacial surgery or pediatric dentistry that extract tooth. If you are looking forward to extracting your tooth, it is them that you are going to go to. So other things, soft tissue infections, different kind of infections, Ludwig's angina. Yeah, let me not bore you with medical jargons, but it is the oral maxillofacial surgery that deals with that. And then we move to the restorative dentistry, which has two branches: the conservative dentistry and the prosthodontic dentistry. For conservative dentistry, they ensure that your tooth remain in your mouth. They do everything that it entails to make sure that your tooth remain in your mouth. So they try to make sure that you don't lose that tooth. So even though your tooth is dead, they fill it up with materials that will allow the tooth to remain on your jaw without dropping off. If you have broken tooth, trauma to any tooth, if you have caries, any tooth infection, that they can still salvage so that you don't have to remove that tooth. They do everything that it takes to make sure that you have that tooth in place. Also, they crown your tooth, different things on under so like the name conserve, they conserve your tooth on your jaw. And for the prosthodontist, that's when you have now lost the tooth. Maybe something happened, you had to remove the tooth, or whatever it is, you lost your tooth. They give you dentures, they give you prosthetic replacement of those tooth, or they give you implants. So under prosthetics, under prosthodontics rather, I don't know why I keep saying prosthetics. Under prosthodontics, they replace those tooth. It might be a full denture, like a full mouth denture, it might be like a partial denture. They might help you put under conservative, that's we have bridges, they can give you bridge, they can a whole lot. So conservative and prosthetics, they work hand in hand. But conservative is for teeth that is still on the jaw. But when you have lost it and then you need something to replace it, that is when prosthodontics comes in. So for implants, dental implants is under prosthodontics. So you're going to be learning that in restorative dentistry. And then we move to periodontology and community medicine. For periodontology, they deal with the supporting tissue of the teeth, the things that make teeth stand in the mouth, your gums, your the bone that holds the teeth in place, those ligaments, those structures that you have learnt in your anatomy that holds the teeth in place, they deals with the health of those ones. So whenever you say, oh, I want to go for my cleaning, I want to go for scaling and polishing, it is the periodontology department that is in charge. So you are going to be going to perio clinic for scaling and polishing and some other things, like they do some other things like frenectomy, gingivectomy. Those are like, let me not bore you with it. When you come inside dentistry, you will understand. And then community dentistry is an aspect of dentistry that deals with the oral health of a particular community, the diseases, oral diseases that are like prevalent there, how to treat how they treat them, how they maintain good oral health in that particular community. And also other community dentistry rather, you are going to also do research. So you are going to single-handedly do a research and you are going to be supervised by a lecturer. So that is all about the courses you are going to be doing your final year. But then final year we have the clinical aspect. So as you are learning in class, you will be going to the clinic to do practicals, to learn in clinic, to work on patients. So as you are learning in class, you are seeing patients, you are learning from patients, you are also operating and treating patients. And also there are requirements. So when you get to your final year, they'll give you requirements, the amount of extractions to do, scaling and polishing to do, root canal therapy to do, and different kind of things. And they are the ones that would serve as a criteria for graduation aside some other assessments. So in your final year you will write tests, different kind of tests, and then you will write your professional exam, which is your final exam in medical school. Thank you so much for watching. Don't forget to like and subscribe to this channel. Thank you. Bye. The GIT gastrointestinal what's GIT? The GIT. So when you get to dental school, you are going to be offering oral anatomy. I beg, let me confirm. What you're going to see in a 2-year-old is different from what you see in a 6-year-old, different from what you see in an 8-year-old, different from what you see in what am I saying? Hi, so I've said a lot, but I realized that my phone stopped recording, so I had to quickly check and adjust it. I hope that I'm able to finish recording before the thing stops. Because you may think you want to cut muscle, may you go and cut blood vessel, or may you go and cut nerve. May that will not happen to us in Jesus' name. Amen. Fire. Okay, so when you pass your part 2 exam, that is when when you pass your part